New Yorkers with disabilities and their caregivers are on the clock tonight. The April 1st deadline to apply for continued benefits under a revamped $9 billion Medicaid home care program is rapidly approaching. Our Dylan Morello has been following this story and tonight is providing further insight on what caregivers say is a cumbersome transition. Dylan.
Marley, caregivers we've heard from are concerned about the Consumer Direct Personal Assistance Program, or CDPAP. The program allows New Yorkers to hire family or friends as paid caregivers. CDPAP is not going away, but Governor Kathy Hochul is overhauling how caregivers get paid, now using a single facilitator, Georgia-based Public Partnerships, LLC.
This is not an easy switch, and whoever thought of it should have thought a little bit more about it.
Nancy Brown and Stephanie Finch, caregivers with 16 combined years of experience, tell us they first heard of CDPAP change through a commercial, only getting formal letters from the Department of Health last month.
Immediately we went on and tried registering, and that just was so difficult and frustrating. The website that they have is very confusing. There's several tabs, and depending on who you talk to, whether it's the facilitator or whether it's PPL, you'll get two different answers.
These unanswered questions have led to PPL saying Monday they have fielded over 770,000 customer calls and have conducted 100,000 outgoing calls.
I wrote down every time I talked to somebody with the date and their name, and I think I have over 30 phone calls.
I started the process on February 12th, and it took me until March 4th to finish.
Over 700,000 New Yorkers use CDPAP. In a statement Monday, the Department of Health says nearly 140,000 people and 150,000 personal assistants started or completed registration, which leaves 58% of current users needing to register in the next 15 days or risk losing care and employment.
Good luck to them if they're just starting now.
State Health Commissioner Dr. James McDonald made it clear Monday, anyone who hasn't started the process yet should get it started today. Brown and Finch add they are now registered, but that leaves even more questions, like PPL requiring training.
Where do we go for this training? How do we sign the training? There's just no answers to that, and they say that's forthcoming. Just wait and we'll either get an email or a text message.
Brown, a full-time caregiver, says her 280 accrued PTO hours and health insurance have been, quote, thrown out the window with this change, a danger for her and the disabled people she cares for.
I would have to work 1 month, at least 130 hours for PPL before I qualify for their, what they call minimum value plan out of Florida. But I don't know what that is.
Now, lawmakers across the state are asking for the April 1st deadline to be pushed back. There's no movement on that as of yet. We have information on the new steps to enroll on our website, WIVB.com. In the studio, Dylan Morello, News 4.